Purines are going to be derived from our diet as well as normal nucleic acid metabolism, and they can be converted into uric acid with the enzyme xanthine oxidase. If we have too much uric acid, it can then crystallize and deposit in our joints, causing gout. Now, we're going to have drugs that can prevent the formation of gout, and these are chronic gout drugs, and we're going to be talking about four. Allopurinol and febuxostat are going to be two of them. They work by inhibiting xanthine oxidase, and so we're going to get less of uric acid as a result. Allopurinol and febuxostat are also going to be used in the treatment of tumor lysis syndrome. So with tumor lysis syndrome, when cells lyse, they release purines, and with excessive purines, that can cause urate nephropathy. So in order to prevent that, we can use allopurinol and febuxostat. Now, because allopurinol and febuxostat inhibit xanthine oxidase, and because azathioprine and 6-mercaptopurine are going to be metabolized by xanthine oxidase, we want to make sure that we adjust the dose of these two drugs when we're using allopurinol and febuxostat. So we want to make sure we lower the dose. Now, probenecid is going to be a drug that acts on the proximal convoluted tubule, and it's going to inhibit reabsorption of uric acid. So if we go to the next slide, we're going to see how probenecid is going to decrease uric acid reabsorption. With the decrease in uric acid reabsorption to the tubule cell, what's going to happen is uric acid is going to build up in the urine. And so the buildup of uric acid in the urine can result in uric acid stones. So that is one of the side effects of probenecid. Now, because probenecid also inhibits anion transporters, it is also going to decrease penicillin secretion. So when we are using probenecid, we want to make sure that we decrease the dose for penicillin, because now we're going to be getting rid of penicillin a lot less. There are also recombinant uricases. Raspberry is going to be an example of a recombinant uricase, and it's going to work by converting uric acid into allantoin, which can then be excreted in the urine. Recombinant uricases like raspberry are going to be first-line treatments for treating tumor lysis syndrome. Now let's talk about acute gout drugs. NSAIDs are going to be the first-line treatment for treating acute gout, and they're going to work by inhibiting the conversion of arachidonic acid to prostaglandin. So we're going to be inhibiting letter C. Remember that prostaglandins are important for protecting the gastric mucosa. And so if we have a patient with, for example, gastric peptic ulcer disease, we want to make sure that we don't give them NSAIDs because it decreases prostaglandin levels and therefore can damage the gastric mucosa. So if a patient has gastric problems, then we can give colchicine, which is the second line treatment for treating acute gout. And the way colchicine works is it's going to bind to tubulin, and so it is going to decrease polymerization of microtubules, which is then going to disrupt the cytoskeleton of neutrophils. So as a result, we're going to have less neutrophil migration to the joints to cause inflammation. So it's going to decrease inflammation. So in this image, it is going to inhibit letter F. So leukocyte attraction to the site of inflammation to cause more inflammation. Now, we don't really know if corticosteroids work for treating gout, but if nothing works, we can give the patient corticosteroids. Now, here's the question: what should you avoid giving in an acute gout flare up? And the answer to this is going to be salicylates. So, we can't give him aspirin because we're going to be getting rid of uric acid a lot less when we give these patients salicylates.